Hello, welcome to Apollo 24/7's Health Hour. So the Apollo family knows, the 24/7 family knows that this is a weekly show that where we bring you experts from Apollo hospitals to speak to you in the live session where we answer your questions. So Health Hour is about asking questions and getting the right answers for you. So here we bring yet another expert to the show where you can chat with them on the YouTube chat. You must be watching this on the other social media of Apollo 24/7. But if you have a question to be answered, if you want a query to be answered, do hop on to the YouTube channel of Apollo 24/7, and in the chat box you can type all your questions and queries. I'm going to place them before our expert today. Also on the show, I'm going to give you health coupons. There's a health quiz coming up. You can win prizes from Apollo 24/7 as well. So I urge you to download Apollo 24/7 app, which can bring you all the facilities that Apollo Hospitals offers into the power of your mobile phone. चलिए आज के टॉपिक के बारे में बता देती हूँ. Today we are going to talk about menopause. Menopause in women causes many changes in their physiology, psychology, and emotional and other health. So let's see how we can address menopause issues. What are the changes, care that one needs, and the supplements that can help. And today we are having an expert from Apollo Hospitals, Indraprastha, New Delhi, Dr. Surpreet Kaur Sandhu, who's an OBG, obstetrician and gynecologist from Apollo Indraprastha Hospitals with more than 20 years of experience. She can be consulted for many gynecological issues: adenomyosis, endometriosis, fertility, menopause, premenstrual syndromes, reproductive system treatment, polycystic ovary like PCOS, PCOD, pregnancy care and management, and a lot of other issues that women face. And here we have Dr. Surpreet Kaur Sandhu. Good morning and welcome to the show.
A very good morning, a very, very, very good morning, all the viewers, all the beautiful viewers out there, and thank you so much having me on this show, Ms. Jhansi. Thank you so much, and for such a wonderful introduction.
Thank you so much. And it's always, I think you, the OBGs, the gynecologists, are the gateway to women's health. I call you the gateway, the gatekeepers of women's health. Because sardard ho ya cancer ho, I think women don't have access to medical system as they have access to you become the gatekeepers. So you are the ones who they explore their health with. So I think it's a great role that you play, ma'am. It's not just a healthcare provider's role, but it's also very important in the social structure that we live in.
Ms. Jhansi, that's all God's grace, and I'll accept that in all humility. But the thing is that every person has to stand for themselves. And in this era of internet and in this century, if somebody is thinking that, okay, somebody else will come and they will tell you about what is going on inside your body or what is wrong with your body, um, that is not okay. The thing is that you have to, even a small kid nowadays, they know that they will be typing anything, not even typing now. So you just have to give that voice message
Voice
and the Google will take, yes, the voice note and the Google will take and you get everything on Google. So
correct.
getting aware is better and you will be
Yeah.
getting your answers.
Correct. So let's start off asking some basic questions कि Google जो आंसर करता है, इंटरनेट जो आंसर करता है, उनको आंसर कर नहीं देते हैं. But today's topic being menopause. Menopause occurs in women quite naturally. Let's understand what menopause is. तो आप हमें बताइए what is menopause and कब से शुरू होता है? One basic detail, please.
Ms. Jhansi, just let me be very short and explicit. The thing is that any person over the age of 40 will be having some changes in her periods or the menstrual cycle. It can be longer, it can be shorter, it can be irregular, it can be regular. The duration can increase, the amount of bleeding can increase or decrease. So near about the time from 45 to 55 years of age, there are certain things which happens, these irregularities, which are normal for this age. Once you stop having bleeding for whole 12 months, then that is the time when you say that you have attained menopause. Anything before that, till the time you are getting all these irregularities till the time you stop with your menses, and that thing stops for 12 months, that is perimenopause. So there are two
अच्छा,
terms. Perimenopause
टू,
are the
सो उसको हाफ अगर आप डिवाइड करते हैं, बंद हो जाना इज द एक्चुअल पॉइंट अगर हम सोचते हैं. सो द टाइम दैट लीड्स टू टिल द स्टॉप इज वन फेज, एंड फ्रॉम स्टॉपिंग टू द नेक्स्ट इज कॉल्ड द अदर फेज.
when once you are off menses for whole 1 year, that means 12 months, you have attained menopause. After
Okay,
that,
so
no bleeding
even
should occur.
12 months. ऑलराइट. सो डॉक्टर सुप्रीत, वन क्वेश्चन कि ये जो 12 मंथ्स में मुझे पीरियड नहीं आया, आई एम नॉट हैविंग अ रेगुलर साइकिल फॉर गुड 12 months, so that is also called a perimenopause, or 8 months down the line I don't have my period, so can I
That is
call myself
perimenopause.
that I have?
That is perimenopause. That is perimenopause. Till the time you attain menopause is perimenopause.
Ah, so we understand these terms. Perimenopause till the time that you don't have bleeding for 12 good months. एक साल तक नहीं है, तब तक वो perimenopause ही है. उसके बाद में
Not
menopause
even
होता है.
spotting. Not even spotting. People, they consider that, okay, the spotting was there. They will consider, okay, there was no bleeding. No. Bleeding should stop. That means not even spotting. You didn't even have a spot for the whole 12 months. Then you are in menopause.
So अगर ये 12 महीने के बाद, if I finish my 12 months of not having a period, not even a spot, not even a dot, if I finished, and then after a year it comes back, if I find myself bleeding again, is this a sign of worry, or I've not hit my menopause? What is it?
But Jhansi, it can be as simple as some local problem or some local infection to something very grave. As we know that any postmenopausal bleeding is associated with cancer endometrium. So it can be nothing. It can just be a local cause. It can be a postcoital bleeding. It can be some urine infection. A person, female, can get confused that she bled from the vagina, or and the blood was coming through urine. To the spectrum goes on to, there are like, that's a broad spectrum. It starts from being nothing to endometrial cancer. So any
Yeah.
postmenopausal bleeding is to be handled or to be consulted by a gynecologist in a physical clinic with physical examination and internal examination. That is to be done. That is the base,
Wonderful.
that is the prerequisite.
Wonderful. So post menopause कोई भी bleeding है, do not ignore,
No.
immediately चले जाइए. That is something.
Yes,
So let's
it
start
can
with
be nothing.
perimenopause. Yeah. Sorry, ma'am.
Yes.
Please continue.
Sorry, I interrupted. I am saying that just do not, just because I've said that it is associated with endometrial cancer. So just because of that fear, you don't have to like cover it or something. Any bleeding which is occurring, if it is local, it has to be taken care of, and it gets taken care of by just simple tablets. That's it, nothing. So once you see that the postmenopausal bleeding has occurred, there is no point of sitting at home. Kindly visit your OBGYN.
Great. So my first and basic question should start from perimenopause, right? So what can menopause cause? The entire period of perimenopause to postmenopause, what can happen to a woman? Is it just like a physical phenomena where I've aged and mere periods abhi band ho gaya? What happens within your body, and what are the changes or the effects that it can have on me?
Ms. Jhansi, the thing is that everything inside your body, basically in female's body, every decade, there is change of hormones. 20 to 30, there will be a change. 30 to 40, there will be change. And 40 to 50, the changes occur. And these 40 to 50, the hormone changes which occurs between 40 to 50 years of age, they will give you there are string of reactions which are occurring inside your body. Just right from having anxiety issues to sleep disorders to mental disorders, not exactly disorders, mental anxiety, your weight gain, bloating, They, as I have said earlier, period irregularities, your anything and everything which is related to day activity, once they start getting affected, then you should really act on it. So there is this whole string of reactions which are going on. Just right, and it is all they are related to one another. If you're not having a good sleep, you will have insomnia. If you're having insomnia, you will have anxiety. If you're having anxiety, next morning you are not going to get up fresh, then you will be saying that I feel really lazy, I feel really weak the whole day around. I could do 10 hours of work or 8 hours of work or 6 hours of work in office before, and now I'm not able to do it. I'm the same person. What has happened? So rather than fighting those situations, it is better to understand that what are the things which are going on inside your body, and
Mm,
everything is related to one another. At the same
right.
time, every person, most of the females, what happens is this is the exact age when they are having fluctuations in their sugar levels and their BP levels also. But they take it for granted that this is because of our age, and this is something related to our cycles, or this is something related to our menses, that we are having this lethargy, this weakness, we cannot get out of the bed. It can be thyroid, it can be BP fluctuations, it can be sugar fluctuations. So a physician is also to be considered. A
Correct.
physician consultation, MD medicine consultation, is also to be done. You don't have to
But
get
here,
biased that it is only because
yes.
of age.
Can
Yes,
I
please.
also highlight one issue, Dr. Surpreet, here? Ki perimenopause में women do get confused because there are other aging factors, other physiological but there have been enough reports or studies which have been going on that a woman can have a brain fog which is because of perimenopause or her failing hormones. So her the body aches. Suddenly she'll have some kind of aches and pains, and the physiological a doctor might say that, "Arey Baba, you are feeling the pain. There is no reason for your pain." But then there are bone health is affected. Your skin, your hair, your thyroid, your other endocrine system, everything is affected because of your perimenopausal conditions. So, what is the link between the female reproductory hormones, which are fluctuating in this phase, and the other health, the endocrine or musculoskeletal health?
Ms. Raji, the thing is that once you are past 40 years of age, the ovaries are producing estrogen and progesterone. There are two hormones. So the
Correct.
estrogen, when it starts reducing, when the estrogen goes down, so the rest of the things which you have, I'm not going to reiterate the same things, the exact same things. Your hair, your bone, your blood pressure, your heart, the rest of the function of the body. It is all mostly in females. It is getting protection from the estrogen, the hormone. That hormone when it dips, that is when you will be having the bone health. To be specific, it is the bone marrow deficiency which occurs.
Mm-hmm.
When we are
Mm-hmm.
talking about the skin or we are talking about hair, estrogen plus vitamin D, there are string of investigations which are to be performed. Yes, estrogen being one of them, but the thing is, when we are in the later part of the talk, we will be going there. What are the supplements or what are the treatment? So in hormone
Yes.
therapy also, if it was only for estrogen, Miss Raji, sorry, I'm so sorry, Miss Jhansi. The thing is, if it was only for estrogen, then the only treatment would have been the estrogen replacement. But is it so?
Correct.
It is not so. So the thing is that you have to go for exercises, you have to take care of your diet, you have to have um, lifestyle
A life
modifications, you have to have dietary changes, you have to have 45 minutes of minimum 45 minutes of cardiac cardiac exercises, aerobics,
good
or
exercise.
anything. 45 minutes of anything which is going on. You have to move your body, some weight training, muscle strengthening that has to occur, and this has to start after 40 years of age. Earlier you start, better you get, because the muscle mass is preserved. And muscle is very, very important because with the passing age, both for the males and the females, but more so for the females, because of the decreasing estrogen, your muscle mass decreases. That should not
Right.
be
Right.
happening. So all these things, they when they are happening, that is the reason when you're having rest of the problems. You're feeling weak, you can't go anywhere, your gastric system is not working, you think your brain is not working, your memory is changing, you're not performing at the office, you're not performing at home, you're getting irritated, your kids are saying that you're not the same anymore. So it is so on and so forth.
So many relations that get affected, Dr. Surpreet. I must say that women around 40, 45, they as such have life में important stages आ चुके होते हैं at that point. Career बोलिए, आप relation बोलिए, work related issues बोलिए, and health. So everything changes. It's so overwhelming for women at that point in time. And physical changes, that you start to look different, and then your emotional relationship gets imbalanced. I have seen in my own cases, in my own family members, in myself, that the responses have changed. The way that I'm reacting and somebody else reacting to me, everything has changed. So what is the role of family in understanding perimenopause and menopause?
That's the most important thing, Ms. Jhansi. Nobody, there is nothing which can, there is no option, there is no other option. A physical, a female's health is, balanced on a tripod, and that is mental, physical, and emotional tripod. Mental health, physical health, and emotional health. Emotional and mental, the most important thing for these 2 points, or these two stands of the tripod, is your family. So family support is of utmost, that's a prerequisite. Your family support has to be there. Now coming back to the physical activity you can perform only when you are having everything good back home, everything is settled. You know that I have told my family is getting through what I am saying, they are understanding. You will be going and you will be doing your physical activity only then. Mental, as I've already said, mental, it depends on that. Emotional, 110%, how you're going around, how your kids are behaving, how your parents on how your spouse is behaving, uh, it really does matter. So the only thing is that again, it comes back to the same thing. पुराने हिंदी में एक कहावत है, अम, घर जीता जग जीत. मतलब अगर आपने घर के अंदर आपका सब कुछ ठीक चल रहा है, तो बाहर तो ठीक चल ही जाएगा. The thing is that
Yeah.
until and unless
So you should
everything
have
is
a good support from home, and that's when you can take care of your health and the women of your
100%.
family in your life. If you want to take care of them in their
Prerequisite.
perimenopause. Yes, wonderfully answered. Thank you so much. Just but there's not much of awareness, Dr. Surpreet, that I understand. Women themselves don't know what they're going through, and men are also confused how to support their loved ones in this phase. What should be the kind of understanding that we want our men and women to have, and what are the points that one can check? See, अगर ये हो रहा है तो ये हो सकता है, इसके लिए ये हम करेंगे. For example, if I'm having a hot flash, if I can have a if I'm having a cold sweat, which is normal in many, what is the reason for that, and how can one help?
Ms. Jhansi, first of all, you have to. It again comes to the same. It boils down to the same point again. That whatever you are considering that this is happening because of perimenopause, you have to have a clear idea that whether you are saying that it is a cold sweat or a hot flush, you should be knowing that those hot flashes, they are not, you are not having high BP, or you are not having a fluctuation in sugar. There are things which are to be considered. Okay, I understand. If you know you have diagnosed, first is the diagnosis, that this is what exactly is the situation you are dealing with. Hot flashes are
Right.
mostly towards the upper part of the body. They will start on your face, on the upper part of the body, and mostly they are there at night. It can happen at any time of the day. But I'm talking about the more common ones. The common ones which occur, they are in the middle of the night. The female will, she is in deep sleep. Suddenly she will get up, and she is all
Sweat.
soaked in sweat. So that is hot flush. You're getting hot flushes. So this is how you, and if the same thing is happening during the day, a female in all probabilities, she will be able to understand, because If she was having BP, which was not diagnosed before, she will having some sort of change in this hot flush. The thing which she is having more on her face or her upper body is not the same thing when there is a BP fluctuation, or you having a vasovagal attack, or you are having a peripheral pooling. A person who has not eaten these things, they are very common. The problem is when the females, they are up and about because of the things which I have stated before. They are out of the bed, they want to go to the office. They have not had their sleep, they did not take their breakfast because they are in a hurry. Now they are in the office, and because of some reason they are standing, the boss is shouting. Very many times what happens is they get the vasovagal attack, the peripheral pooling, जिसे चक्कर आना बोलते हैं, and they will fall down. At that time, the sweating which is occur, just before that, they will be having an episode of sweating. Now, you don't kindly do not confuse that thing with a hot flush. It has nothing to do with hot flush. That is different. So, first of all, the diagnosis is to be made. You will be treating the thing only when the diagnosis is made. So, in all those
Correct, correct.
situations, you have to go, okay. And at this is the exact time where the family is helpful. The family will tell, you know, Mama, you were not like this before. Now you are going, very many times your face get flushed. You are having, that pinkish tinge on your face just before having these hot flushes and all. So all these things, they are seen and they are experienced by the family, which was not happening before. They will come to the clinician. It is very important when such females, when they are coming to the OPD, they should be accompanied by one of their family members. Because very many
Right.
times the female, she herself is in denial because of all the
Correct.
hormone things which are going on. She's in denial. Nahi, and because of that, every female is very strong. They're epitome of strength. So they will always say that I can do this. हो गया, एक episode हो गया, I can go. When you talk to their family members, they will tell that there is nothing like one time. This thing is happening since months and months and so on. And she will tell you like this. So this is where the family thing is come. The diagnosis has to be made. And when you're talking about husband, the most intimate relationships, they will depend and they do change. There is a massive change. And it's the same
Yes,
thing. The
let's
husband.
talk about it. Loss of libido, not able to perform, not, the physical intimacy is greatly affected by the perimenopause and the menopausal women. So, what happens in that phase? Is it really true that the vagina gets dry and you do have certain issues, pain hai, bleeding hota hai? Is this true, ma'am?
Jhansi, as it happens with aging, the whole of the skin changes. The whole of the skin of the body will change. As your face skin change, the facial, the skin tone, the skin turgor, the skin elasticity, it changes. More so in the intimate areas. Dryness will occur. There will be loss of elasticity. There will be loss of turgor. There will be dryness in the skin. So the same sexual activity which was not giving any problem before will start giving problem now. And what are the problems? The problems being the major one beings that they do have pain. That pain that can occur because of the loss of elasticity and the dryness. The females, most of the time when a male and female are together, there is a term which is known as foreplay. Why this
Huh.
foreplay is said? The foreplay is only done why so that the female gets wet. There is a time,
Correct.
there is one because of the uh, increasing age, you take time
Hmm.
for those glands around the vagina, inside the vagina, to make those discharges which we say that the female gets wet, and then only the sexual intercourse should be done. That takes more time. Now, in this era of quickie, and everything, when the female is not that much wet, when she is not ready, and sexual intercourse happens because of that dryness, because of that loss of elasticity of the skin, the abrasions they occur. There are, hum, if, in a simple Hindi word, what we say, zakham. The female will feel that something has hurt her. There are
Huh.
abrasions and there are infections, and that is a breeding ground of bacteria or fungus. the area is dry, then it is having infection, it is humid, that is a it's a breeding ground for the bacteria or fungus to proliferate. So
And
the thing is,
thereby they do not want the physical intimacy because they are in pain, and that affects
this
the
this
relationship cycle.
this is how it begins. This is the I just told you the root cause. From next time onwards, she'll try to refrain from that because it was not the pain which she had at the time of sexual intimacy. It is the aftermath of that whole thing that she had that infection, she had urination problem, she had frequent urination, she had burning urination, micturition, she had that aftermath. So after one sexual contact, if she is having this problem for days, she will start refraining from it.
Correct.
So this is
So
what
as
happens.
such, एजिंग है, ड्राई वजाइना है, सेक्रेशंस कम है, डिस्चार्जेस कम है, ऊपर से ये इंजरीज भी हो चुके हैं, तो इन्फेक्शन हो चुका है, and the cycle repeats itself. So let's understand how we can protect our women more. There are a few questions, Dr. Surpreet. I think from the audience, let's take some questions. The first
Please,
question,
please.
before I take WebGNX, Anuradha Parthasarthi, can I ask you for your age, please? Please do text your age and other details while we take up other questions. Age is 42. The female, suddenly, first time in my menstrual cycle, I am having issues. Period running as long as 14 days. I used POS 500 medicine. I also got a TVS transvaginal scan USG. My report is showing bulky uterus with adenomyosis, small fibroid 1.8 and 1.35 centimeters, and a few Nabothian cysts in cervix, largest being 0.59 centimeters. So, इनका question है ये भी पेरोमोनोपॉज के कोई issues है क्या मैम?
Ms. Jhansi, the thing is that when we are talking about this, the only problem is that whether this thing was existing before, because she is saying that she is having adenomyosis. Now, adenomyosis in the layman language, as simply as I can explain, is just the change in the size of the uterus and the texture of uterus. So,
Correct.
very many times, such females, they will be bleeding more and they have agonizing pain during their
Period.
cycles. And when they are having adenomyosis and fibroids, that is really, it's too much painful. It's very, very painful. But it won't start just when she has turned 42. It won't start at that
Hmm.
time. There is a gradual
Hmm.
increase in these symptoms. The frequency and the severity of the symptom will increase over time. It is not acute in onset. Anything which is acute in onset is what is to be considered hormonal or age related. So that has to be differentiated. Now, I have no idea, Miss Anuradha ji, because she has already taken this TVS, so she must have consulted the gynecologist also. So,
This
what
is a
exactly is her
French
question?
person. का नाम नहीं दिया है, 42-year-old female. Anuradha's question next I will take, but this is a different question. Yeah.
Acha, acha, हाँ जी. नहीं, this you have to differentiate that she is having some menstrual irregularities because of the organic, that is a local cause, which is
Correct.
related to the uterus. That can be
So that is not
fibroid, that can be polyp.
perimenopause नहीं है वो. अलग है. That's a separate section that we need to look at.
That is hormonal. That is hormonal.
Ah,
A same uterus, which was not giving any irregularities before, has started giving irregularities now. So that is hormonal. That is
okay.
perimenopausal. But from a uterus which was having fibroids, was having adenomyosis, there were some irregularities. They can increase with perimenopause.
Okay.
With a hormonal
Right.
imbalance, that can increase.
So what is the
This is how
option
you
for
have to do.
such cases? What are the options that they have?
It can be as simple as taking some medications to reduce the bleeding, to hormonal treatment, to hormonal pills, to there are IUCDs, intrauterine contraceptive devices, the hormonal ones and the non, in this case, hormonal ones, to surgery, to removing, you have to take that is from, that depends from patient to patient. So that is a clinical
Correct.
decision which is to be made. That only hysteroscopy DNC will be okay, or there should be a whole soul hysterectomy which should be performed. So that is when you have to, that's in a clinic diagnosis. So that is to be decided
Right.
in a clinic.
All right. So that was about her question, and then that does not amount to perimenopause, is what we understood. Here's a perimenopausal question. Prashanti Chaudhary, good morning. I am getting my periods in time, but after 5 days of bleeding, again within 5 days, I'm spotting with the blood marks. There's no heavy bleeding, ma'am. Regular way of bleeding only. I'm using G post PD Ron 15 CR. My doctor suggesting every time. Is it good to use? That's
She
the
is
question.
taking some, yes, Hanji. Ms. Jhansi, what's Miss Prashanti's age?
She's not given it there. Prashanti, please type your age.
Anyways, if she is
Yeah,
taking
let's.
this hormonal pill, she must be between 35 to 45.
Okay, could be, could be. We will
So
wait
the
for her
thing,
to back.
sure,
And but generally, what happens, ma'am, in that age
it's
group,
this
35 to 45?
post menstrual bleeding. This condition is named as post menstrual bleeding. So this again
Uh-huh.
can be a normal, it can be a hormonal imbalance. Very many times the people, those who are trying for IVF, there are
Uh-huh.
certain medications and there is some treatment which is given because, and when they are not going for the same, uh, there are
Hmm.
certain changes in the cycles which occur. So maybe because of some, what I'm trying to clear this thing, Ms. Jhansi, what I'm trying to clear the things is that it is just not perimenopause. That can be because of some medications which were being taken in the past, or some treatment which the person is undergoing, or to a very basic cause of hemoglobin deficiency. So the
Okay.
CBC, the basic complete blood count should be done, and she should see that whether hemoglobin is okay. Because if she's anemic, she will be having this spotting. This is
All
post
right.
menstrual spotting.
Okay.
Pre-menstrual spotting also occurs. But the thing is, rather only perimenopause may not be the cause. The rest of the causes, they are to be seen. They are to be evaluated.
Great. So next question, Anuradha has texted her age. She is 47-year-old female. Anuradha Pardasarathi has been diagnosed with a bulky uterus and has very heavy bleeding. I do not want to consider my Mirena and hysterectomy. I am managing my hemoglobin levels with supplements and pause MF to control the bleeding. So now she wants to know if she is taking a sane decision by not having all these, by not opting surgery.
Ms. Jhansi, until and unless her daily activities, the normal daily routine is not being affected, whatever is controlling her bleeding, and she is able to go on with her daily activities with the normal fervor. If she is getting a good response out of it, so what she is doing as of now is perfectly fine. The
Right.
treatment is good.
So
On,
that's it. Oh, only
only
when.
and
Yeah, please continue, ma'am. Sorry.
Auntie, sorry. Only when it is giving you grave problem that you're having so much of bleeding that you cannot move, you're not getting out of the bed, your sheets are getting soiled, you are not able to go to the office, you're not there, you are not able to take care of your children, the family, you're having major mental stress at that time. I'm not saying that you have to wait for that thing to happen. Anything like from normal to this stage, at any point when you think that you won't be able to take it or it is hampering your daily activity, you do have to go ahead. And Mirena, she says, okay, I understand she doesn't want to go for Mirena. If she says hysterectomy, she doesn't want to go for that. These are not the only two options. There are still other options if something happens. So let her not get blocked by this idea that only Mirena and only surgery is the option. There are other options.
Great. So, Anuradha, I think you will make an informed decision. Keep yourself. Awareness is everything. Once you know that you are doing something with awareness, with right direction, you will understand what your body is going through, and you will only come and reach out to a right gynecologist to for the right option. I think that that should be the best way that every woman, Anuradha, आपकी तरह अगर everybody is aware of their bodies and taking decision with informed decision लेते हैं तो बहुत अच्छी बात है. So that's the power that we can give the women. Yeah. Here's the next question, ma'am. There's no name here. 45-year-old female hai. I might be in a menopause or a perimenopausal phase. I'm not sure, but 45-year-old infection where the urine passes. It starts a little paining while passing urine with pressure. Is it because of some reason or constipation, etc.? What do I need to do?
Constipation will never give you pain while urination. This is the first thing. Second, kindly check your water intake. If your water intake is less, which is true for 90% of the females in any part of the world, I get it. I'm getting the message. So
Sorry.
that water
Moment
intake.
somebody says water, my brain activates that I need to have a sip of water. That's a condition that I am. I'm sorry. Please continue, ma'am.
Now, because of the because yeah, she is 45 years of age, so her urethral mucosa, urethra is the connection between the bladder and the outside. So that urethra, the mucosa is the inside skin of that urethra. Because as I have said, the vaginal mucosa, the vaginal from inside the vaginal skin will get dry, it will get irritative. The same thing happens with the urethral mucosa also. Even that becomes dry, and that is
Okay.
it's the thinning out, thinning out of the mucosa. Very many times there is inflammation which is present, and when you're having less of water, your concentrated urine, it irritates it further, and then you enter into a vicious cycle
Oh,
of
okay.
not passing the urine. When you're passing the urine, you're feeling burning, you're feeling pain, and then you altogether stop water intake so that you don't have to pass urine, and that's a vicious cycle which you enter, which you don't have to enter. So the thing is, kindly have lots and lots of water. So this is what is happening. This is the first thing. But the second thing is, as I was telling earlier that you have to do exercises, pelvic exercises, Kegels exercises. They are easily available on internet. Pelvic exercises, they are special exercises for the pelvic muscles. See,
Right.
Ms. Jhansi, what happens is our uterus is, I don't know whether it can be seen on camera or not. It's like a
हाँ,
hammock. The pelvic muscles, they are like hammock. They are like
हाँ.
hammock.
आपके
So
पास
your
लीजिए
uterus
मैम, आपके
is
पास.
sitting on that.
हाँ.
Your uterus is sitting on that. In front of the uterus is the urethra. When this hammock goes lax because of the lack of physical exercises, as the rest of the muscles in your body, they start becoming lax. Lax and dhila. Same happens with
Right.
this. This hammock goes lax. Uterus
Hmm.
starts sagging down. So does the urethra. Because of this, there might be, in very many cases, what happens is there is, whenever the most of the females past 40 years of age, they will say that when we are going for running or we are dancing or even
Coffee.
activity as simple as sneezing or coughing, they think that the urine leakage, one or two drops of the urine leakage that occurs. The musculature, which I said, that hammock, which provides a support and a seal to the urethra, is not working the way it was working before. So, what you have to do is kindly exercise. Everything will come down back to the same thing. You have to exercise, your dietary changes have to occur, your physical changes, your lifestyle modification. And every female who is past 40 years of age, please do Kegels exercises, pelvic exercises. They are known as
बहुत
pelvic
ही सिंपल
exercises.
होता है. जैसे आपको गूगल करते हो तो मिल जाएगा वो कीगल एक्सरसाइज कि आप यूरिन पास करते हुए जैसे वो मसल को कॉन्ट्रैक्ट करते हो. और कीगल्स एक्सरसाइज बहुत ही सिंपल है. चेयर में भी बैठ के कर सकते हो, किसी को दिखेगा भी नहीं आप कर रहे हो. सो इट्स अ वेरी वेरी इंटरेस्टिंग थिंग, एंड once you know how to do this, there's so much power.
Yes, yes, Ms. Jhansi, it has to be done. And exactly, it is truly, you absolutely correct. You were absolutely correct that even while you were sitting, if I'm sitting here, you're sitting there, even as we are talking, we can
किसी को
perform
पता भी
it
नहीं
and
चलेगा
nobody
कि
will
हम
know.
कर रहे
Nobody will know.
हैं.
And this
Correct.
has to be repeated. There should be at least 100 reps
Ah,
in a day, 10 to 15
wow,
times every time. Yes, there should, yeah,
that's an
there should be 100
interesting.
reps.
ये पहली बार सुन रही हो कि 100 reps at least throughout
100.
the day, not
Miss Jhansi,
continuously.
when I
10
say 100, that number is a large number to hear. But when you know how to do it, even when you're sitting or when you're walking around, at one, it there should be three sets. Okay, you're doing three sets of 15 reps each.
45 हो
So
गया.
that is 45. That's 45. And if you're even you have a repeat the 15, if you're having 15 reps and two cycles and you're doing that thing like two, three, four, 5 times a day while you're walking, it is easily above 100. Very easily above 100.
करेक्ट. ऐसे
So
ही
the
चले
whole
जाइए
day around
हम
you
तो.
have to achieve that.
Great, ma'am. Thank you so much. So, also, it's important for men to talk. Here's Mr. Tatara's question. Tatara is asking about 53-year-old Sujata. Uh, she has sweating in full body. इतना ही मुझे details दिया. There are not much of details which are available in the question. He wants to ask about a woman who is 53 and has sweating in full body. What does it mean? I'm so glad that this
When was the
gentleman is asking
That is
for
so nice. The
somebody.
family support. This is what we were talking about. Yes. So, when did she attain her menopause? How long she has been in menopause for? Let's suppose that is already she is already in menopause or she's undergoing menopause. So, if her blood pressure, I'm taking everything like a benefit of doubt. I'm just taking everything to be normal. If her blood pressure is normal, her sugars are normal, and she is already into her menopause. So this whole body sweating, which is episodic, which can come anytime, unannounced, is a hot flush. So it has to be
Ah,
taken care. It has to be
how
taken
can
care
one
of.
help? आफ्टर मेनोपॉज क्या होता है मैम? अब तक तो हम पेरीमेनोपॉज बात कर रहे थे कि मेनोपॉज आइडेंटिफाई करना बात कर रहे थे. व्हाट विल हैपन? आई एम डन विथ माय ब्लीडिंग. आई एम डन फॉर 12 गुड मंथ्स. 2 साल भी हो गए. नाउ व्हाट विल हैपन टू मी? आई हैव नॉट डन एनीथिंग. पहले जो 40 से मुझे 50 तक जो करने थे, आई हैव नॉट डन एनीथिंग. ऐसे आ गई हूं मैं मेरे मेनोपॉज में. नाउ पोस्ट मेनोपॉज क्या होता है?
You have to start from the basics. Doesn't matter at what stage you are. The thing of management is the management still remains the same. Your lifestyle changes, they have to be there. Your dietary modifications has to be there. There are for the diet, I'm not going to go into those specificities. It is just going to lengthen this discussion. So there are flax seeds. There are certain seeds which simulate the natural estrogen inside the body that is to be taken. Your lifestyle modification will include yoga, meditation, breathing exercises, more of physical activities, anything which you find solace with. If you're having not only the physical activities, you kindly have one hobby of yours, at least dedicate 20 to 40 minutes of your day, if possible, to those activities as well. Good sleep. A sleep is a must. And if you're having problem with the sleep, kindly go and see a physician. That is very, very important. Hot flushes after 3 years or 4 years of menopause is not
Can
that
I
common.
add something? Mr. Tatarao has replied here that Sujata's 53-year-old Sujata's cycle has stopped 6 months back, and now that they are identifying, so Mr.
Sweetheart is
Tatarao
again the
must be
same thing. She is not in menopause yet. That is
yes,
perimenopause. That will be 12
that's what.
months, yes. So
Huh.
this is
So Mr. Tatarao,
so the
please note that she has not attained her menopause yet. So full cycle until the time that she has not had her period for 12 months, you have to watch out for.
So that's the rest of the things remains the same. And again, her BP and her sugar, that is of utmost importance. That is to be checked. The fluctuations,
Correct.
there are major fluctuations. At this age, there are major fluctuations, and they missed because they say that
Yeah.
we have not had any BP or sugar in the rest of our lives. It cannot happen now. but it has to be checked.
Correct. So yeah, keep an eye on it. And what is the hormone replacement therapy and how will it help and who requires all of that?
Ms. Jhansi, as gynecologists, we refrain from hormone therapy as long as possible. I'll tell you why it is not to be taken first, and when it is to be taken, I'll tell you afterwards. So, why it is
Right.
not to be taken is important is because the side effects of the hormone therapy, it is not as simple as infection or something. No, the side effect of hormone therapy is cancer. Very many,
Correct.
yes. So, it can be breast cancer, uterine cancer, according to the hormone therapy which you are taking. So that also depends that once a person is like postmenopausal, the estrogen is added when the person is having perimenopause, as this gentleman was asking. So at that time, you have to have this estrogen and progesterone. There's a combined hormone therapy which is taken. So the side effects being, which I've already stated, so only when the things are not getting controlled and the symptoms are not getting controlled, the hormone therapy is started. And it is to be started under surveillance. Once started, every 3 months to 6 months, there are checkups, both the internal checkup, physical checkup, blood investigations, ultrasound. There are a whole string of investigations which are repeated. They are to be repeated, and they are to be the patient is in continuous follow up. It is not like that
Hmm.
you have started taking hormones and then you come after 1 year or so. No, you have to go. You have to regularly go and be in the follow up of the doctor who has prescribed that. Before prescription, a whole body check, along with the rest of the things which I stated before, your ultrasound, your blood investigations, the rest of the things they will be taken care of before the start of the hormone therapy. So this is when nothing else is working. The female is not able to sleep. She is not able to go around with her daily physical activities. The yoga, meditation, diet, lifestyle modification is not working. Then we start with this.
Correct.
So this is when
So here this is
it
not
should
for
be started.
everybody. Very clearly we understand that this is not for everybody, but it is for somebody who is unable to deal with their day-to-day life, and that will be reserved in only for the gynecologist's opinion when to
Yes,
start and when to stop and how to give. But
yes,
ऐसे मैं
yes.
बोलती हूँ, but what about the other women who are suffering in a day-to-day life? That means that I have to endure the suffering in silence. What else can help other than the lifestyle changes, the diet, the exercise? Can Are there some kind of supplements? I see so many supplements out in the market. What's the role of these supplements?
Ms. Jhansi, I wish I had an answer for that. I'll tell you, basically, the thing is that when you're talking about these supplements, they are not FDA approved. You have no idea that what they are promising and what is there inside and what quantity it is. If they are say,
Correct.
okay, flax seeds, you can take it, you know that the flax seed you have gotten that bottle, and you know that these are flax seeds in it. I understand that. But the rest of the supplement, which is in the powder form or it is in the liquid form, we have no idea. But then also, let us make a neutral ground that if we consider that everything is fine and you're getting the supplements which are having the ingredients as they are promised in the quantity in which they are promised. So, yes, they do help. Anything which is more of soya, which is having more of soya products are beautiful. They are amazing in perimenopausal time. Soya products are kindly go as low on dairy products, go as high on soya products. Soya milk, tofu. Not to that extent, I'm not a very big fan of Nutrila because most of the soya is extracted. Nutrila is just the byproduct. When everything is extracted, that is what the Nutrila is. But anyways, if you're not having anything else, you can go for that also. Then comes
Yeah.
the flaxseed.
Can I?
Gee,
How about while we are talking about soya? Do I, for example, I've been living with hypothyroidism for a very long time. So other endocrinological issues भी कैसे ध्यान में रखें?
uh, Ms. Nachi, again, the thing comes that when we are considering perimenopause, only a gynecologist is not sufficient. There is a whole team of the doctors which is involved.
Very interesting.
Endocrinologist, physician, gynae being there. In case,
Yes. And also,
in case.
Ortho as well, because other
Yes,
musculoskeletal systems
100%.
की osteoporosis set in हो जाता है
100%.
menopause time पे,
100%.
cardiovascular system is changing, heart
Yes.
attack के risk बढ़ जाता है. So
The
it's not just
CVS
a
and the
gynecologist.
organ. So this is it. So the this was a very valid point you raised, that hypothyroid people, what they should be doing. So there should be a mediocrity in what you are taking, but that is to be decided by the endocrinologist. The good endocrinologist, they always have this dietitian, their own dietitian with, she will explain it to you that you have to go more for the flax seeds and rest of the soya, and what are the other things which can be considered, less of the dairy products or whatever. They will tell you. There is no problem. But the thing is, in general terms, these are the things which help. The soya products will help, the flax seeds will help, and definitely all that exercises and all, lots and lots of water. Rehydrate, 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 rehydrate yourself. As much of water as possible. That is the coolant
How
inside your
about
body.
vitamin and other mineral supplements? What are most important? जैसे calcium है, D
Vitamin
है,
D, vitamin
हाँ,
D,
please.
vitamin D. Vitamin D is very, very important. I'll come back. I missed this point there when we were talking about the sexual intimacy. Most of the females, they think that it is only because of the vaginal dryness and itching that they are having pain at that time of sexual intercourse. But Ms. Jhansi, what happens is when they are deficient in vitamin D, the bony pain is also there, which is
Oh,
confused with the vaginal pain. So once
okay.
you give them this vitamin D, they are really good. They come back like anything.
Yeah, yeah. So vitamin D is something that you got to check, girls. After 40, keep your blood tests on. Apollo 24/7 is your partner in getting. What do you suggest, ma'am? एक quick test ऐसे run कीजिए that why should keep my awareness on? कि कब करवाऊँ, कैसे test करवाऊँ? Ma'am, after this, I have two important questions. I have two people who are asking. एक तो health पूछ रहे हैं and दूसरा एक very important genetic and family history का question पूछ रहे हैं. But quickly आप बता दीजिए मुझे क्या test run करने हैं.
The normal whole body check is perfectly fine. Normal CBC with ESR, LFT, RFT, the blood investigations. Uh, if you are consulting a physician, kindly take them into the loop also. Let's see what, according to your BP and sugar, GTT and your LFT, the lipid profiles, X-rays, bone, DEXA, that is very, very important. TMT, if it is advised by the cardiovascular. Your ultrasound, the basic ultrasound. I think so. This basic checkup is okay. Ms. Jhansi, once in a year, whole body check is very, very important.
Yeah.
We here at Apollo,
To keep a record.
I
Huh. Please continue, ma'am.
Yes, I myself, I'm there in Apollo Health Check. So I take care of the Obs Gynae department there. So I tell all my patients with a the most common question is while they are leaving, when they're getting the whole body checked up, they are so happy. If all their investigations from the gynae side are okay, I'll tell them that, okay, nothing is to be done. You don't need any medicines. They are so happy. The next question is that when do we have to come back? If everything is
Yeah.
fine, once in a year is perfectly fine. Your pap smear has to be done. I'm just talking about the gynae purview as of now. So
Yes,
the
yes,
pap smear
yes,
is to be
that's
done. Mammogram is to be done. Breast ultrasound is to be done. Ultrasound, uterus, and the whole body ultrasound. It is okay. The whole abdomen ultrasound and pelvic ultrasound is to be done. So this is once in a year. If everything is fine, very
yeah.
well and good. Otherwise, the doctor is taking care. They will tell you that you have to get your pap smear repeated if some infection comes. It can be in 3 months, it can be in 6 months. Your ultrasound breast is to be repeated. Mammogram is never repeated less than a year.
Yeah.
Mammogram is never repeated less than a year. Ultrasounds can be done. So ultrasound is to be repeated in 3 months, 6 months, whatever that the doctor will tell you. The doctor will guide you. But once in a year is okay enough.
Sure. So quickly, there are because I'm running short of time. I have two important
Please.
questions, ma'am. Pranita Bhagavatila says her mother hit menopause at the age of 36 years, and she is 31 right now. Any chances that I might attain menopause early too? जैसे early menarche का history है, menopause का भी कोई parental guide ऐसे कोई है क्या, मैम? hereditary,
So Jhansi,
genetic?
most of the females, they will be following the genetic pathway. Now, the only because of I have no idea about her family history or family tree, she should be going and she should be asking if she has maternal aunts and if they are elder, what with her first cousins, maternal cousins, Masi ki betiyan. So, at what time, and if she is having elder sisters, and if everything is not there, if she is not having maternal aunt, she is not having maternal first degree relatives, let us just consider that she is the only daughter and her mother got her menopause at 36 years of age. There is a term which is known as premature menopause, which happens because of the hormonal imbalance. And it is then again, it is subdivided into very many categories. It can be just because of, there is a one term, one condition when a female delivers and because of the excessive bleeding, she will never get her periods again. This is also one of the condition. There is something which goes in on the pituitary gland and that shrinks, and after that, then she never gets the periods again. So there is this one syndrome, and it is very common. The second thing, when she has had her delivery and she bled so profusely that the uterus was taken out, so that is known as obstetric hysterectomy. That's the other
Correct.
reason. These are the common. They are the common reasons. And the third
बट
and the
मैम,
lesser common one.
एक क्वेश्चन यहाँ पर, अगर ये हिस्टेरेक्टमी हो गया और मेनोपॉज मेडिकली हिट हो गए, तो सेम कंडीशंस होते हैं क्या? सेम हॉट फ्लैशेस, सेम काइंड ऑफ इश्यूज हो सकते हैं, एंड विल
I'm
बी
so
सेम
glad you asked this
गाइडलाइंस?
question. I'm so glad you asked this question. The thing is that when you get your uterus removed, not necessarily that is the decision which is taken by the gynecologist who's operating according to the age and according to the stage of the ovary. If the ovaries are healthy looking, the ovaries are left behind. The
करेक्ट.
hormones are produced from the ovaries. It is never produced from the uterus. So the uterus is
करेक्ट.
out, only the bleeding will go away. The rest of the cyclical things will be there. You will get your estrogen, you will get your progesterone, only the bleeding is not there. Premenstrual breast pain is still there. Most of the females they will come, now I'm not having my bleeding because my uterus is out, but my breast, they still hurt. Why is that? Because the ovaries were left behind and they are still producing hormones in that cyclical manner. It is happening.
हाँ.
So only the menstrual cycle is not there. The menstrual, that means she's not having the bleeding. The rest of the whole of the hormonal cycle is still there. And that will wane down, it will go down according to the natural age, as it
हाँ,
happens
that
with
is it.
any other female. That's
करेक्ट.
natural.
ओके, या यहाँ पर एक हिंदी में ही दे वांट एन आंसर इन हिंदी. नमस्कार मैडम
जी,
जी, मेरे हर महीने मासिक नियमित तारीख को आते हैं, और नाम रजनी है इनका, 37 इयर्स है इनके. दिल्ली. आपसे निवेदन है कि समाधान हिंदी में बताइए, बट या अनियमित तरीके से हो जाते हैं. That's it. That's her question. And also, Simran, you have joined lately, but late, but doctor has already answered. पेरियोमेनोपॉज है क्या? 40-year-old इरेगुलर पीरियड है लास्ट 2 साल से. डॉक्टर ने बोला है कि पेरियोमेनोपॉज है. शुड आई टेक हार्मोन्स आर्टिफिशियली? इन दोनों के लिए प्लीज हिंदी में आंसर.
जी, जी। रजनी जी, सबसे पहले आपका प्रश्न का उत्तर ये है, आप बोल रहे हैं अनियमितता है जो उसके अंदर अभी हुआ है कि वो पहले से है? अगर वो अभी हुआ है तो आपका जो लास्ट चाइल्ड बर्थ, आपका अगर बेबी अभी हुआ है 1 साल 2 साल में एंड आप बेबी को अभी भी फीड करा रहे हो, इट कैन बी ये उसके वजह से हो सकता है। जब तक आप फीड कराओगे, थोड़ा-सा आपके पीरियड्स में इर्रेगुलैरिटी बनी रहेगी। आप उस चीज़ के लिए चिंता ना करें, सिर्फ़ अपनी प्रेगनेंसी का ख़्याल रखें, क्योंकि इस समय प्रेगनेंसी होने के, एक्सीडेंट होने के बहुत ज़्यादा चांसेज़ रहते हैं। क्योंकि आपके पीरियड्स इर्रेगुलर हैं, आपको ये लगेगा कि वो तो इर्रेगुलर हैं और प्रेगनेंसी मिस हो जाती है और वो 3 महीने, 4 महीने, 5 महीने में जाकर के पता लगता है। 37 इयर्स,
हाँ.
38 इयर्स, 40 कई बारी 44 तक भी हम लोगों ने ये देखा है। ये वो जो आपको हो सकता है आप उसके लिए देखें। नहीं तो
या.
आपने जाकर के एक बार अपना इन्वेस्टिगेशन करवाना है। हमें ये पता लगे कि आपके हार्मोन की वजह से हो रहा है कि यूट्रस में कोई प्रॉब्लम है। अगर यूट्रस में कोई प्रॉब्लम है तो फिर आपको उसके हिसाब से मेडिसिन्स दिए जाएँगे। सेकंड क्वेश्चन वाज़ पेरीमेनोपॉज़ जिनको 2 साल से आई थिंक सो दैट सेकंड क्वेश्चन आई कैन आंसर इन इंग्लिश इफ शी
You
इज़ ओके
did.
विथ दैट?
I think, ma'am. Ma'am, I think you've answered it really very well, and then we're also hitting last minute mark. So I think we'll conclude that. Simran ji, ये episode पूरा आप एक बार record देख लीजिए, मैम ने answer कर दिया है. So Dr. Surpreet, I think with that I'll have to conclude this session. So आपने एक quick 2 top tips please, because I'm running short of time. It's already hit 12. So 2 top tips
It's
for
as
me.
simple as that. Dietary modification, lifestyle changes, take care of yourself. All the beautiful ladies outside there, just have a full control of your body, be aware, and whenever there is a problem, kindly go to a gynecologist and ask for her advice. Your inner circle is okay, but kindly take a professional advice. Thank you so
Wonderful,
much.
wonderful. Thank you so much, ma'am. I'll take leave from you to continue quickly health quiz ke liye. Thank you so much once again. And here are the
Thank you.
three questions.
Thank you.
Yeah, 3 questions I'm going to ask you on the quiz, and you need to answer. I want this slide to be changed. The team to be kindly take a note. You have to send your the details if you're the winner to marketing at apollo247.org, not on something. It will be left on the chat as well. So here are the 3 questions. The question number 1 for today: menopause is a natural part of aging, true or false? Menopause is a natural part of aging, true or false? Question number 2 is fill in the blanks. Please fill in the blanks to create a word which starts with H and ends with L, S. It is H blank T, F L blank S H blank S. These are common symptoms of menopause. Fill in the blanks to get the word. Dash are a common symptom of menopause. Question number 3. Exercise and lifestyle changes can help in managing menopause symptoms. True or false? Exercise and lifestyle changes can help in managing menopause. True or false? Yes, these are the 3 questions. Go ahead and type your answers, and people, you have to, if I take the winner, that you are the winner, you have to write back to us at marketing at apollo247.org. And here are the coupons that you can use on Apollo 24/7. And the first one is Ask Doc 150, consult top doctors and get 150 cash back. And the next one that we are giving away today is First 3, FIRST3. Get 2-hour delivery and use this code to order medicines to get 25% off on online medicine orders. And for our Health Hour viewers, HH247, if you're new to Apollo 247, download the app and use HH247 to get 199 off on online consultation with Apollo doctors and 20% off on medicine orders as well. And also, Apollo 247 can be accessed on WhatsApp as well. So please use this number 9355247247 to get all the services of Apollo 24/7 on WhatsApp. By the way, next week we are talking about dengue. We are talking about a very, very important subject: what are tests, treatment, home care, when to visit hospital, all of that we are going to talk. And this week, by the way, a lot of people who are asking about 15th के मेरे health credits नहीं आया किसी के, कभी-कभी time लग जाते हैं. Sometimes we do take 3 to 4 weeks to process the health credits as well, depending on the week that it is. And a lot of them are answering. Let me see if our team is looking into. In case that I will have to close the episode right now because paucity of time, the winners will be put in the chat box, and you will have to get back to us with your details before Wednesday of every week to marketing at apollo247.com. I still don't have the winners, but I'm past. The winners are here. The team has put the winners in the chat box as well. Pranita Bhagavatula, Tajinder Singh, and Aman. Pranita Bhagavatula, Tajinder Singh, and Aman, you are the winners for this week. Please do write back with all your contact details to marketing at apollo247.org and you claim your prizes. Thank you all of you for joining us this week. It was an interesting session with Dr. Surpreet. Thank you, namaskar, and bye-bye.